If you're dealing with erectile dysfunction, stay with me for this one. I want to talk about ED properly today, and not in a shamey way, not in a jokey way, and not as in a quick fix and move on type of way. I want to talk about it as a real, useful, practical way because ED is so common. And for a lot of men, it can feel so personal, it can hit their confidence, and it can affect their intimacy. It can make men go quiet, and I want to say something clearly right at the start. This is not about masculinity. ED does not define your masculinity, and ignoring it does not make you stronger. If anything, it takes more guts to speak up, ask questions, and get proper advice than it does to stay silent and just hope that it goes away. That's strength. That's leadership. That's taking your health seriously. Maybe this is you. You're tired. You've had a big week and intimacy comes up and all of a sudden something feels off. Then your mind starts racing. Is this stress? Is this age? Is this something actually wrong? And instead of talking about it, you carry it quietly within. If that sounds familiar, this episode is for you. Hi, I'm Saara Jamieson. I'm the founder of Cool Beans Underwear, and I'm a science-trained founder and a mum to Heidi and Van. And my own infertility journey completely changed the way I look at men's health. It forced me to ask better questions, to dig into the science and see how often men's symptoms are getting dismissed, delayed, or they're just misunderstood. So what I'm doing now is translating peer-reviewed clinical information into plain English for everyone, because prevention protects the next line of generation. And that's what exactly today is about. If you stay with me to the end, I'll give you practical things you can do starting tonight, not to replace proper medical care, but to help you stop guessing and start paying attention to the right things, to look at signals. Now, a quick note before we begin. This is educational content only. This isn't medical advice. It's not a diagnosis. And it's not a substitute for personal care. If you have symptoms or concerns, please see your GP or treating clinician. All right, let's get into it. The first thing I want to say, and this is super important, is that erectile dysfunction, it is not a diagnosis on its own. It's generally a symptom. It's a sign of something that's happening deeper down. And for a lot of men, it can reflect a much bigger picture involving blood flow, metabolic health, hormones, how well you slept, stress, even your medications, pain, nerve-related issues, and a mix of multiple things happening at once. That's why I don't like the way ED is often talked about, as if it's one isolated problem in one isolated part of the body, because often it's not. A lot of men go straight to what's wrong with me, or I'm broken, or this is just age, this is normal. You do not need to just get through it, and I get it. So many men, and maybe yourself, feel incredibly vulnerable. It can affect how a man sees himself. It can affect how he interacts with his partner. It can make men withdraw. It can make them avoid intimacy and definitely avoid that doctor's appointment. But a much better question than what's wrong with me is, what is my body trying to tell me? That's the mind shift that we need. Okay, so I often explain ED like a warning sign on your car dashboard. That warning light matters. So absolutely, the light itself isn't the whole problem. It's telling you to look under the bonnet. So if the only thing we do is stare at that warning light and feel embarrassed about it, we can miss the opportunity to look at what's actually driving it. And I want to be really clear about what ED means too. When I say ED, I'm talking about erectile function, specifically difficulty attaining and or maintaining an erection sufficient for sexual activity. This is not the exact same thing as low libido. It is not the exact same thing as ejaculation problems. And it's not the same thing as being able to orgasm. Yes, they can definitely overlap, and they often do, but they are not interchangeable. And that matters because it changes what actually needs to be assessed. For one man, desire may still be there, but erection quality has changed. For another, what feels like ED might actually be severe fatigue, low libido, and stress overload. Could be something to do with pain management, medication effects, or a combination of multiple different things. And if you're listening to this and thinking, I don't even know how to describe what's happening, that's okay too. Many men don't know how, as this may be the first time they've found themselves sharing information like this, and it's incredibly common. Now, ED obviously matters because of sexual intimacy and the ability to reproduce, but it also affects confidence, mood, your relationship. It can create distance between you and the one you love. It can create avoidance and stress on both sides. But clinically, ED matters for another reason too. Sometimes ED is the first symptom a man will actually bring up. He may have been ignoring fatigue, poor sleep patterns, snoring, the fact that his blood pressure is increasing, weight gain around the middle, that they're feeling flat, unmotivated as they have no drive and the ability to bounce back after exercise. And then ED becomes a thing that they finally gets them to ask someone for help. And if that happens, that can actually be a really important prevention moment. Because sometimes ED is the symptom that can catch the bigger health picture earlier. Now, this doesn't happen every time and not to every man, but often enough that it matters. And this is why I feel so strongly about this, about talking about what ED is without shame, because shame delays care. Men normally wait. They hope that it passes. They tell themselves they should just push through as they think that they look weak. But asking for help early is not weakness. It is one of the strongest things a man can do for himself, his partner, and his long-term health. And if you're a partner watching this, the goal is not pressure, it's support. The most helpful thing is often helping create that safe conversational environment, not forcing an answer in one night. Now, one of the biggest mistakes people make with ED is assuming there must be one single cause. Sometimes there can be one dominant driver, but for a lot of men, it's not that simple. It's more like a stack of things all pushing in the same direction. Maybe your medication has changed. Maybe you're consuming a large amount of alcohol daily or weekly. Your confidence has taken a hit, and now the whole system is in overload. So the better question usually isn't what's the one cause, it's what aspects of my daily life are having a more impact, causing larger amounts of stress than usual. That question is far more helpful, and honestly, it's more hopeful too. Because if there are multiple contributors, there are often multiple places to support that improvement, and understanding this is vital. Now, let me quickly bust a few myths here. because these keep men stuck. Myth 1. If it happens once, something is seriously wrong. Not necessarily. One bad night is not the same thing as a pattern. Myth 2. ED automatically means low testosterone. Not true. Hormones can absolutely be part of the picture, but ED is often bigger than just one hormone. Myth 3. If I ignore it, it'll sort itself out. Sometimes a short-term issue does settle, but sometimes ED is the first sign of a bigger picture that needs attention. Myth 4. Asking for help is weak. Most definitely not. Asking for help early is strong, and it can protect your long-term health and relationships. So when we talk about ED, I like to think about it in buckets. Not because the body works like that in little boxes, it doesn't, but because it helps make a complex topic easier to understand. The main buckets we usually look at are blood flow and vascular health, metabolic health, hormones, nerves and pelvic or urological factors, stress and mental load, sleep, medications or treatment-related effects. That is why proper ED conversations should feel bigger than just one symptom, because it usually is. That's why proper ED conversation should feel bigger than just one symptom, because it usually is. Let me walk through those in plain English. First, blood flow and vascular health. This includes things like blood pressure, cholesterol patterns, smoking history, endothelial function, and broader cardiovascular health risks. Blood flow matters. That doesn't automatically mean that every man with ED has a cardiovascular disease. But yes, ED can sometimes be an early warning sign in some men. That's one reason it matters as a prevention conversation. Second, metabolic health. This is a big one. Things like insulin resistance, type 2 diabetes risk, central adiposity, so your weight around your organs, metabolic syndrome, inflammation, and energy regulation can all influence sexual function. These things don't stay in a neat little box. They affect your energy, your hormones, your ability to recover, your mood, and how your body just turns up and functions day to day. Third, hormones. And I want to be very careful here because the internet oversimplifies this all the time. Not every case of ED is low testosterone, but if ED is happening alongside low libido, fatigue, lower drive, fewer morning erections, slower recovery, flatter mood, or reduced motivation, hormone assessment may absolutely be a part of the picture. It just needs to be assessed properly, in context and not guessed. Fourth, nerves, pelvic factors, and urology-related contributors. This includes things like neuropathy, nerve damage to those nerves which are outside of the brain and spinal column, pelvic floor dysfunction, chronic groin or testicular comfort, post-procedure changes, pain, and local irritation. These things can affect physiological function. They can affect your confidence, your ability to respond, or just the rate of responsiveness. And they can affect willingness to engage sexually. Fifth, stress, sleep, and mental load. Anxiety, depression, stress, poor sleep, apnea, fatigue all matter. And they can all contribute towards ED. That doesn't mean the problem is necessarily all in your head. It means the body and brain are connected. Sleep, stress physiology, hormones, vascular function, nervous system overload. They all talk to each other. And sixth, medications and treatments. Some antihypertensives, some antidepressants, psychotropics, and opioids, they can all affect sexual function. That does not mean you stop your medication, most definitely not. It means you need to review them properly with your clinician if something has changed and you're concerned. That is the difference between guessing and assessing. So if I pause and summarize where we are, ED is common, it's often multifactorial, and it deserves a proper whole person assessment. That's the foundation before we even talk about support options, and that leads us to another really important point. One bad night does not define your health. Poor sleep, stress, alcohol, overheating, fatigue, a huge week at work, relationship tension, all of that can affect erectile quality and function in the short term. A one-off event is not the same thing as a pattern that changes over time. I think this is where a lot of men get stuck. They either panic too early or they ignore it for too long. So I want to offer a middle ground. Now, don't spiral over one bad night, but don't ignore a pattern either. A pattern is useful information. It doesn't mean you're broken. It means your body is giving you data, and good health decisions usually come from data, not shame. Now, let's talk about what good ED assessment conversation can actually look like, because men often feel out of their depth here. And I want to make this feel simpler. A good ED assessment should feel like someone is trying to understand the entire whole picture, not just what's happening in the bedroom. What's changed? When did it start? Did it come on suddenly or gradually? Is it occasional or consistent? What's your libido doing? What about morning erections? How's sleep going? Are you finding yourself feeling stressed? Are there any relationship strains? Any medications changed? Are you consuming more alcohol than usual? Do you have any pain, discomfort, or groin symptoms? Then there are broader aspects that need to be considered too. What is your blood pressure like right now? Metabolic health? Do you have a risk of diabetes? Have you had weight changes, loss or gain? How's your energy currently? Are you able to recover from strenuous training or lack of sleep? Are you finding any hormonal symptoms? That kind of conversation is where you stop guessing and you start getting useful answers. That doesn't mean everything is wrong. It means you're not guessing and you can start interpreting the data. And that mindset shift really does matter. A proper assessment is not about creating fear. It's about reducing blind spots. If you only patch the symptom and never assess the cause, you can miss the real issue. And with ED, that can matter, not just for sexual function, but for your long-term health. And there are times when not to sit on this. If ED is sudden, rapidly worsening, happening alongside significant pain, neurological symptoms, major urinary changes, or you're feeling generally unwell, don't just watch YouTube and wait. Get assessed properly. Now, a question I get asked a lot is there something I can do before I see a doctor, like a survey or checklist? And yes, there is. A really common screening questionnaire used in clinics is called the SHIM. That's SHIM. You might also hear the IIEF5 questionnaire. I'll put links to both of those down in the description. But think of it as a conversational tool, not a pass-fail test. It's a short questionnaire that helps rate what's been happening things like confidence, firmness, and whether you can maintain an erection. Now, a really important aspect of this is the boundary and distinction here is that it does not diagnose the cause. It does not replace a proper assessment. And it does not tell you what is definitely wrong. But it can help in two really useful manners. First, it can help you put words to what's happening, especially if you're struggling to explain it. And second, it gives you a clearer starting point for a GP or urology appointment because you're not walking and saying, I don't know what's wrong, just something feels off. You can walk in and say, here's what I've noticed and here's what's changed. That makes the conversation easier. And if urinary symptoms are part of the picture too, things like urgency, frequency, weak stream, or getting up at night, that is another reason to mention it clearly to your clinician. Because urinary symptoms and ED often overlap, but they still need proper assessment. So yes, a questionnaire can help. Just use it only as a starting point, not as a self-diagnosis. And if you are planning to book an appointment with your clinician, another very helpful and practical thing you can do is track the pattern for a couple of weeks. Not just your sexual performance, but your sleep, stress, exercise, alcohol consumption, any medications you might be taking, mental health daily, and anything else you may notice. Whether you wake up in the morning with an erection, how many times you got up during the night to urinate, and perhaps during the day, and compare that to how much fluid you're actually consuming. You don't need perfect, you don't need a perfect spreadsheet, just honest notes. Now, as you're listening, I want you to think about this. What has changed? Was it sleep? Stress? Maybe you're finding your energy levels are different. Are you lacking confidence? Has your weight changed? How is everything functioning in your body? It can make your appointment much more useful because you're bringing data, patterns, and not panic. And while we're on practical things, I want to say this clearly too. ED does become more common with age, but that does not mean it should automatically dismissed as just aging. Aging and ignoring are not the same thing. Now, a quick reminder before I move on to where Cool Beans may fit in this conversation. New episodes drop every second weekend, and the blog on the Cool Beans website has the key takeaways and clinical resources if you want to go deeper into understanding this problem, this condition. Now, I'm building this series so men, couples, and clinicians can have better conversations sooner with less confusion and less shame. And in a minute, I'm going to walk you through where Cool Beans may sit as a support option for you with very clear boundaries because I want that part to be useful. We'll take a quick break here. When we come back, I'll walk you through exactly where Cool Beans may fit into this conversation, what we do, what we claim, what consumer feedback is, and what we're seeing, and how to talk about it responsibly. Most men don't realize this. Your testes are the powerhouse of male health, not just fertility. Testosterone impacts energy, mood, drive, muscle, fat loss, sexual performance, and long-term health. But modern life can trap heat right where you don't want it. Hours on office chairs and car seats, a bit more weight on the body, sweat, and undies that squish everything back where it can't breathe. That's why I built Cool Beans Biomedical Everyday Underwear, registered as a medical device here in Australia. The external pouch holds everything forward, helping reduce heat buildup, moisture, and friction.
and supporting how male anatomy is meant to sit. Men use cool beans alongside fertility care, but we're also seeing it used along urology, oncology recovery, including post-op support and during chemo and radiation, where comfort, swelling, and skin irritation can become a daily battle. And with 3 pouch sizes, men can now choose more room when they need it and adjust things as things settle. If you've got symptoms, though, do seek care with your GP and/or specialist. To try Cool Beans, head to coolbeansunderwear.com and use code CBEducation10 for 10% off.
All right, welcome back. Now I want to shift into the Cool Beans part of this very careful and very clear consideration if you're struggling with ED. Cool Beans does not claim to treat or cure erectile dysfunction. ED is multifactorial and requires appropriate clinical assessment and management. So if anyone is watching this and hoping I'm about to say that this solves ED, I can't say that. But what I can say is that we've received strong consumer feedback from men describing changes like better erectile firmness, less testicular pain or irritation, improved comfort and confidence, and in some cases, becoming sexually active again. And to make this more real, the feedback usually doesn't sound like this cured my ED. It's more often things like, I've noticed firmer erections, I feel like a 20-year-old stud again in the bedroom, I feel more sexually responsive, I've got less pain and irritation in the groin, I'm feeling more confident in the bedroom again, I'm actually being intimate again. We've also had some men tell us that it feels easier to urinate. These are self-reported observations. They are not clinical proof. They are not treatments or claims. And they do not mean Cool Beans cures ED or urinary dysfunction. But they are meaningful because they reflect what men are actually doing, what they're experiencing day to day. And they've been consistent enough for us to pay close attention and build a careful hypothesis around why some men may be noticing these changes. Another thing we've noticed is that this feedback is after a consistent wear, generally over about 2 to 3 months. While we receive countless feedback like this, with Cool Beans aiding men in ways we never imagined, results will vary between individuals. So the way we talk about this is as a hypothesis, not proof, and our hypothesis is that in some men, what they are noticing may reflect a 3-prong effect. Reducing avoidable local heat load, improving scrotal support, and reducing downward drag-related pressure, and reducing the drag-related irritation that may affect local sensory signaling. It is a hypothesis for why some men may notice a difference in the broader symptom picture of ED. Now let's unpack this a little bit further. The first prong, heat load reduction. Cool Beans is designed to help minimize avoidable testicular heat exposure during daily wear by reducing the thigh insulation and supporting airflow. What I'm saying is that heat stress has mechanistic evidence for affecting testicular function and testosterone in a clinically relevant to sexual function, libido, vitality, and broader well-being. We now know that men only need to sit on an average of 20 minutes, and that's long enough to heat their testes to a point to diminish that cellular production of the testes, essentially switching off or reducing testosterone and sperm production. Therefore, by reducing testicular heat, theoretically testosterone production increases improved sexual performance and desire. So in men where heat, sweat, irritation, and discomfort are part of the daily lived picture, reducing avoidable local heat burden may support the broader symptom context in some men. Prong 2, testicular drag-related vascular compression or irritation. Essentially, men have scrotums and testes that can vary in shape and size. The heavier they are, the more drag you get. Our hypothesis is that in some men, ongoing scrotal drag due to the weight of the testes, thigh compression and local tissue pressure or irritation in the groin region may contribute to compression affecting local vascular structures, meaning the blood vessels located within the groin. And when we say vascular, we need to talk about both sides of blood flow, arteries bringing blood into the region and veins draining the blood out of the region. Our hypothesis is that by reducing that testicular drag, by supplying scrotal support, may reduce drag-related compression or irritation and support a healthier local blood flow environment, meaning more natural arterial inflow and venous drainage outflow from the genital region that may contribute to perceived improvements in erection firmness, because we all know in order to maintain or get an erection, it is the blood flow coming into the penis that allows that erection to occur. Now, the third prong is again drag-related pressure from the weight of the testes, is the irritation affecting neural signaling, affecting how the nerves fire within the groin region. Now, this is really important one because erectile dysfunction is not only vascular, it's also neural. Can the nerves fire when required? There's sensory input, there's automatic signaling, then there's the arousal pathways, then the body's ability to respond to those signals. And all of that can be influenced by what's happening locally within the groin. So our hypothesis is that in some men, in the groin and scrotal region is dealing with ongoing testicular drag, related traction, pressure, or irritation that is affecting the local sensory signaling, nerve firing, and genital responsiveness. Now, to try and explain this in a grounded way, I'm not talking about anything dramatic, and I'm not making claims about diagnosed neurological disorders. I'm talking about the idea that if an area is irritated all day, the body can become guarded. And if the body is guarded, that can affect how an area feels and responds. So if better support reduces testicular drag and reduces that local irritation, our hypothesis is that it may help create a better functional environment for sensory responsiveness in some men. Now, that can show up like improved sensation or responsiveness, less distraction from irritation during intimacy, improved confidence, and in some men, perceived improvements in erection firmness within the broader vascular and hormonal context. And honestly, I think this is one reason some of the feedback we receive sounds bigger than people expect from underwear. Because for some men, we're not just talking about clothing preference, we're talking about day-to-day heat, friction, drag, pressure, discomfort, confidence, sleep disruption, and how the body feels over hours and hours of wear. Now, another point I want to include here, because this comes up in feedback and I don't want to avoid it, is urination. Some men have also reported that it feels easier to urinate after consistent wear. This is important to handle carefully, but as hypothesis-generating observation, it is interesting, and it reinforces the idea that support, testicular drag, and the local environment may matter more than people realize in men. And that's exactly how we hold it, with curiosity and with boundaries. When men report positive changes, we often hear that it happened after consistent wear, not random wear, after around 2 months. Now, that time frame is anecdotal and self-reported. It is not guaranteed and it is variable. And results will vary between individuals. But it's still useful to mention because a lot of people expect overnight changes. And unfortunately, the body just doesn't function like that. It's consistency that matters, context matters, and the broader health picture matters. Think about when you start an exercise regime. You're not going to lose 10 kilos overnight, but with consistency and dedication, you may actually lose that 10 kilos you're wanting to lose. So if I pause and summarize this part, Cool Beans is not being positioned as an ED treatment, but it may sit as a support option for some men, where heat, drag, and friction and discomfort are all part of the lived symptoms picture. So if we were to give you the cleanest clinical style positioning for where cool beans may sit in this conversation, it would be this. Cool beans may be positioned as a support, heat management, and drag reduction support for men who are undergoing appropriate ED assessment and care. Particularly where groin heat, friction, inadequate support, scrotal drag, or discomfort are part of the lived symptoms picture. And that's exactly why this conversation matters, because men deserve practical support and proper clinical care, not one or the other. Now, we're going to take a quick break. When we come back, I'll walk you through what to do next if ED is on your radar, including what you can do this week, how to track the pattern, and how to make your GP appointment far more useful.
If you're watching this series because you're trying to feel better energy, sleep, mood, health, I wrote a book that explains why so many men feel flat right now and what you can actually do about it. It's called Cool Beans, One Woman's Mission to Reclaim Fertility Through Men's Health. And it follows my 3.5-year infertility journey and how I flipped the script to focus on men's health and what's happening globally with testosterone, fertility, and long-term well-being. And what does that mean for the next generation? It's packed with practical steps for him, for her, and for couples, all backed by peer-reviewed clinical data in plain English. If you want a signed copy, you can grab one through the Cool Beans Underwear website. If you'd rather, Amazon, it's available unsigned and on Kindle. And if you've got symptoms or concerns, always consult your GP.
All right, welcome back. Now, let's bring this back to what you can actually do from here. Because I never want an episode like this to leave you with information and no next step. If ED is on your radar right now, here's what you can do this week or starting tonight. First, don't panic over one bad night. It's patterns that matter much more than one-off events. Second, track the pattern. It doesn't need to be perfect, but honesty. You need to look at those patterns and do a full picture analysis, not just in the bedroom, but also your stress, your food, your exercise. They all can have an impact. Third, if you want a structured starting point, complete the SHIM or IIEF5 questionnaire and book an appointment. Again, I'll put the links in the description below and in the corresponding blog, along with user feedback of Cool Beans, which you can find on the Cool Beans website. And use this questionnaire as a conversational tool with your partner and clinician, not as a diagnosis. Fourth, if it's persistent, worsening, affecting your quality of life, or happening alongside fatigue, low mood, poor sleep, weight changes, rising blood pressure, reduced exercise tolerance, or metabolic concerns, make booking the appointment a priority. Fifth, ask for a whole person assessment, not just symptom patching. You can still pursue symptom support, but ask for a broader assessment. These things generally happen alongside other health conditions, so it's really important to have that whole picture so you can look after your health and wellness, and your longevity, to make sure that as you age, you're only going to be hopefully improving your health, not letting your health demise. Sixth, pay attention to the daily environment in the groin and scrotal region. You're wanting to pay attention to heat, friction, testicular drag, and pain within the groin. Lack of scrotal support, sweat, any type of discomfort and irritation. And it won't explain every case, but in some men, it is absolutely part of the lived picture. 7th, and don't do this in silence. Talk to your GP. Talk to your partner. Ask questions and get support. Because this is men's health, but it affects everyone who loves a man, not only the man involved. And I want to say this too, because I know some people watching this may feel vulnerable hearing all of this. You do not have to be perfect. You don't have to have the perfect words before you ask for help. You do not need to know the diagnosis before you book the appointment. You do not need to walk in with a complete explanation. You can simply say, something has changed and I want to look at it properly. That is enough. And that's a strong place to start. At the end of the day, the biggest message I want this episode to leave you with is this. ED is common. ED is not just one thing. ED can be a health signal, and ED deserves proper assessment, not silence, not shame, and not guesswork. Supportive strategies can be part of the picture, and in some men, especially when heat, friction, drag, and discomfort are involved, but they should sit alongside proper assessment, not replace it. And that is the kind of men's health conversation I want more of. Honest, grounded in science, and practical. Because we're all human. If this has helped you ask better questions, book the appointment, stop ignoring a pattern, or support someone you love to seek help earlier. Every step matters. Data beats guessing. And early conversations can change lives. If you've been feeling hot and sweaty down there, dealing with chafing or heat rash, don't just tolerate it. Those can be signs that the area is running too hot, too damp, and too high in friction. And that can affect comfort, movement, and the way you show up day to day. So let's remove that barrier. Go to coolbeansunderwear.com and try Cool Beans today and use your special discount code CBEducation10 to get 10% off. And if this episode has helped you or a loved one, share it with a man that you love, because the right information really can change lives, not only for the man, but those that love him too, and the family he loves in return. Till next time, take care. I'm Saara Jamieson from Cool Beans Underwear, and I can't wait to see you in another 2 weeks. Bye.